So in my previous video, I talked about how I'd prepare for a genomics STP interview. So in this video, let's talk about how I'd prepare for a cancer genomics STP interview if I had to prepare for one today. So for cancer genomics, first thing first, I'll go online and research about the very basic information I need to know about the specialty, like the gene, the genome, what is cancer. Then very importantly, I would research on the classification of cancers. It's very tricky. You don't need to know so much, but I just need to make sure I understand the very basic ones. So I would understand the difference between a benign tumor and a malignant tumor. I'd also look at the classification of cancers like the carcinomas, the sarcomas, the myeloma, the leukemia, and those type of classification. Then you also bear in mind about the classification based on location, just the very basic information. Then I would also visit the genomics test directory for cancer. That document have all the approved tests for different type of cancers, and very importantly, it also have the technologies used to test for each type of cancer. Like in my previous video, I talked about the cytogenetic techniques and also the molecular diagnostic techniques. So we have the fluorescence in situ hybridization, karyotyping, microarray, next generation sequencing, PCR, qPCR, and all the sequencing technologies. I would make sure I understand these techniques. I'll also understand how they work, read up on the principle. This is how I'll prepare for the specialty part of the interview, because I think they have a pool of questions and they can ask you any question. So even if I tell you the exact questions I was asked during my interview, it might not be helpful to you because you might not be asked those exact questions. But the very important thing is to know how to prepare effectively. So how is cancer diagnosed? You need to understand that there are a lot of tests and process that the patient go through before it gets to cancer genomics, which is why we do histopathology rotation as cancer genomics trainees, just to understand the very basic where it comes from. So the patient get biopsies and it goes through histopathology test, and the pathologist would then diagnose and say the grade of the cancer, how far it has gone, and the tumor, is it benign, is it malignant. You can also talk about the imaging technique that they use. So the clinician will use all this to decide what type of cancer does this patient have. Then for the molecular test, which is what we do in cancer genomics, I'm just trying to be very basic, not to give too much information. So for cancer genomics, majorly our tests would help the clinician with targeted therapy and personalized medicine, just to know the exact treatment that would best address that patient cancer. We also test for some minimal residue diseases. I don't think you need to know all that. Just understand how cancer is diagnosed. Then you know where cancer genomics come in. Then again, you need to understand the role of a clinical scientist in the patient pathway, right from the point where the patient comes to the hospital until when they've gotten their treatment and where they are discharged. Where does a clinical scientist in cancer genomics come in? So you need to understand that that's the type of research and the type of information I'll be searching for if I have to prepare for the specialty specific questions for cancer genomics. I hope that helps. If you have any more questions, drop it in the comment section. If you want me to focus on any part of the specialty specific questions for cancer genomics, drop them in the comment section and I'll try to address them. Bye.